All right, I think we have to start. Let me see who can get in, and then so. All right, so hi. Good. All right. So I am allowing Dr. View in now as a panelist, and then I'm allowing Dr. Hello, Dr. View. Your microphone is still muted. Yeah, I can't hear you yet. It's muted. I'm just trying to wait for Dr. Morgan. All right. Okay, so I think we have to get started because and people are already joining to be part of the webinar. And first and foremost, I'd like to thank everyone, our panelists, for joining us to be panelists today to this webinar on self-care and the influenza season. And I just want to thank you for taking the time out of the busy schedule to do this. And we will go around the room and introduce ourselves, what our roles are, and then what we do, and we'll set it rolling that way. So I'd like to begin with you, Dr. View. Can you tell us something about yourself, what you do for the hospital system, and in what role are you working for us? Can you check your microphone, Dr. View? No. Huh. while we try to check your microphone, let me move over to Stephanie Brown. Stephanie Brown, thank you very much for joining us as a guest panelist from Sullivan County. Can you please tell us something about yourself? And
Sure.
let us know who you are, what you do, and
okay. Can you hear me okay?
Yes, I can hear you now.
Wonderful. So my name is Stephanie Brown. I'm the Commissioner of the Division of Health and Family Services for Sullivan County. I oversee 4 departments for Sullivan County: the Public Health Services, Family Services, Community Services, and our county-owned nursing homes. So that's 4 pretty big departments that have been hit pretty hard by COVID, and will also, going into the flu season, have some challenges associated with that. Prior to this, I was the assistant county manager. Prior to that, I was director of office for the aging. Prior to that, I worked for public health. So I've come full circle. I used to be a public health nurse and quality improvement coordinator at Public Health Services. And yep, and now I help to oversee the department that's been instrumental in responding to the COVID pandemic, among other communicable diseases.
Wow, thank you so much, Stephanie, for you have a wealth of experience and knowledge, and wow, I don't even know what to say to you. And we have Jackie Lawler from Orange County. She is on the phone with us. We can't see her face, but we can hear her very loudly and clearly.
Thank you, Andrew. Again, my name is Jackie Lawler. I'm the Director of Epidemiology and Public Health Planning for the Health Department. I've been here just over 11 years, and prior to my position as the Director, I was an epidemiologist as well. So I've spent most of my professional career over at Orange County. So I'm overseeing the COVID response currently, but generally, outside of COVID, half of my job involved communicable diseases, and the other half has really been data management. So the community health assessment, the community health improvement plan, working with the hospitals, being the liaison for a lot of community-based organizations, and working with the community. So I thank you for having me tonight, and I look forward to talking to you about the challenges we're going to have with flu this year.
Thank you so much, Jackie. Thank you so much, Stephanie. We're still having some issues with Dr. Ville's microphone, but as soon as we're able to resolve that, we'll circle back with him to kind of get a sense of what he does for us. But let me just quickly introduce him to us, and then we'll continue with Stephanie and Jackie in the meantime. Dr. Ville is the Director of the Behavioral Health Services for Garnet Health. He's one of our doctors who's been helping to move things forward, and then he is recently the chair of the department and trying to expand our tele-psychiatry program in the hospital system. And we are really lucky to have him, and we're blessed to have him work for us and lead us in this venture. So Dr. Ville, keep working on your microphone, but we are happy to have you, and hopefully your mic will work eventually. So where do I start? Jackie, let me begin with you, because you lead the current role right now in terms of COVID and in terms of what we're doing now. So tell us, given the fact that that we have these public health concerns right now, what do we need to pay attention to, and what guidelines is provided from the CDC? Jackie Lawler, please.
Thank you, Andrew. I think one of the benefits, at least for flu and COVID, is that they have some of the same protective measures that we would want to take. The one benefit right now is that influenza does have a vaccine available. So I think one of the most important things that your audience needs to know is that everyone needs to be vaccinated for influenza, 6 months and older. There are multiple varieties. They are effective. I know getting the flu shot does not give you the flu. So that's really important to know and out there, but it's going to be one of the best ways, if not the best way, to protect yourself against the flu. Subsequently, because we have, a mask order in New York State since April, those masks will also help you protect against those large droplets that flu normally transmits through sneezing and coughing and fomite transmission. So pieces of paper, doorknobs, things that you handle all of the time, may share with other people. So again, one of the biggest things to prevent both flu and COVID at the same time would be, of course, washing your hands with soap and water constantly and not touching your face before you're washing your hands. And if soap and water are not available, of course, using hand sanitizer, which is in every aisle of every store nowadays. So those things are really super important. So wearing your masks, making sure you get vaccinated for influenza, washing your hands. Two other things I would say is staying home when you're sick. And I think the schools are doing a really excellent job of this, of keeping their students and staff members safe by keeping people home when they're sick and they're not feeling well. And I think workplaces have really stepped up as well, realizing that, again, maybe it was obviously driven by COVID, but especially important for flu, that you will see hopefully less flu transmission, and particularly in the workplace, because people are not coming in when they're sick. And unfortunately, you can spread influenza about a day or so before you show symptoms, but those things like washing your hands and wearing your mask and keeping away from other people, the socially distance, those measures will be protective measures for both flu and for influenza. The thing that might be interesting just from an epi perspective is that the Southern Hemisphere absolutely saw less flu transmission during their flu season. So it will, we're hoping maybe we'll see the same here. And we think that is mostly due to all of the precautions that they took in regards to COVID is there as well. So we're hoping that that will also translate to less flu and less death, of course, for flu as well here, because flu, unfortunately, is deadly. So get your shot, wash your hands, wear your mask, stay home when you're sick, and limit your social gatherings, particularly around the holidays.
Wow. Tons and tons of information at that point. But let me ask you, maybe dig a little deeper into those statements you just made. And I want to specifically ask a question in regards to getting the flu shot. Now we're hearing about new vaccines for COVID coming up right now. And then we have people who are afraid of taking the flu shot or taking the COVID shot. What do you think? Why should we even understand all of these, given the fact that some people already have that problem of taking the flu shot? Now we're in the flu season. Now there is, in the process, and kind of the emergency authorization in the works for the COVID vaccines. So can you speak to that if you can?
Sure. So I think what people maybe don't realize is sometimes they'll say, oh, COVID is just the flu, which we know it's not. But when we talk about the flu, sometimes the flu kind of gets this like bad rap in terms of, oh, it's just really just a cold that knocks you out. But flu is a really potentially serious disease that can lead to hospitalization and death. And every flu season is really different. So influenza infections, they affect people differently. Millions and millions of people get flu every single year. Hundreds of thousands of people are hospitalized. Thousands to tens of thousands of people, depending on the year, die from flu-related causes every single year. And the vaccine is the best way to help protect against flu. And so though, it's not 100% vaccine, no vaccine is 100%, but the ability to get a vaccine reduces not only your chance of getting the flu, but also reducing your morbidity from the flu or complications from the flu. And so that vaccine really helps cause antibodies to develop in your system, about 2 weeks or so after infection, or after your vaccination. So it's really important to go and get that flu shot as soon as possible so that you build up that immunity in that 2 weeks, so that you can be protected when you come across it. We are starting to see flu here in Orange County and in the Mid-Hudson region, and now is the time to get vaccinated while it's still low, because that way you can build up the immunity when you might come across it.
Wow. So it's always very good to get a flu shot. COVID flu shot, COVID vaccine, and then the regular flu season flu shot. But then, in terms of the incubation period, what do you think is the difference? What should we know when it comes to the incubation period between the influenza season and the flu, and COVID? Should we make sense of the difference in terms of the incubation period?
So the incubation period for influenza is actually a lot shorter than it is for COVID-19. So it's generally about 2 days incubation. So that means from when you were exposed to when you start to show symptoms, but it's anywhere from basically 1 to 4 days that, when you were exposed to when you show symptoms. COVID is unfortunately much longer. So it can be anywhere from 2 days to up to 2 weeks. Where you were exposed potentially almost up to 2 weeks ago, but you won't show symptoms potentially until, the day 13 or 14. Most people show them within, 5 to 7 days, but it's absolutely happened that people have showed it toward the end of that, closer to that 2 week period. We've seen that not only at the county level, at the state level, in research journals. So the incubation period, the time that it takes you to get sick, is much longer for COVID than it is for flu.
But is it different either for COVID or for the flu shot between children and adults? Is there any difference in terms of the incubation? Does it apply to people differently?
So we don't have a COVID vaccine. Well, hopefully we'll have a COVID vaccine soon, but we don't have that quite yet. So for flu, the amount of time does not vary between, a child and a person for when they start to get, when they were exposed to when they start to get sick. So that doesn't change between the two of them. And in terms of the vaccination, it might depend on the type of flu shot that a child gets, whether they need 1 or 2 doses. It's very specific about what kind of strains are in the vaccine and if they've ever had a particular type of strain in the past. But for most people, it's just a one-time shot per year.
Wow. Thank you so much. I'm going to give you a break and then turn over to Stephanie to ask her some few questions with regards to the specifics of the work she does and then where she's working and the kind of things she's going to be facing with that. You've worked so well for the past few months with COVID emergency response team in Sullivan County. So tell us, what do you think poses more danger to people in terms of being immune compromised, at least for people who live in residential facilities? And then how do you think your work in the past due to COVID can help us understand how we should keep ourselves, keeping in mind that the older people among us in the community have much more propensity to get sick because of that? What do you think would be poses more danger to those who have compromised immune system?
I have an interesting and unique perspective because I took on the commissioner position in February of 2020. And, March is really when everything went through the roof. And one of my departments is the care center at Sunset Lake, which is a nursing home. And not only did I oversee the nursing home at the height of the pandemic and continue to do so, but I was also the acting administrator for a short amount of time. So I have intimate knowledge of the effects of COVID and the flu on these particular vulnerable populations. I think what we find most dangerous is, if you've been following the governor's executive orders, you see that he has restricted visitation on residential and nursing home facilities. So these restrictions are in place, meaning visitors can't come in and visit with their loved ones. That also means that people can't bring it in from the outside. But my concern is the staff members, the people who are working in these long-term care facilities, who are out in the community and are engaging and are gathering. And I can't guarantee compliance with mask wear and some of the different protective measures that we put in place. And so our staff are out in the community and they're coming in and they're interacting with the residents. So from my perspective right now with my work and where I work, my office is in the nursing home. My biggest concern is the exposure that my residents may have following staff members coming through. One of my other concerns too, especially with these people in residential or nursing home facilities, is that a lot of them have neurological impairments that may inhibit their ability to communicate when they're feeling sick or when they're feeling a different particular way. So it's very important for staff members to stay on top of that, to know the residents, to pay attention and pick up on the signs and symptoms of things, different behaviors, maybe different signs that these people would exhibit that they wouldn't be able to tell us about. So those are some of my concerns right now. And it's the same for the flu and for COVID. So we have both of these infections that are out in the community that can impact my residents. And then with my other departments, because we're still open to the public, we still have public clients coming in and out of the doors. So we're always concerned that there could be a potential exposure there as well. And our older people, a lot of them have these comorbidities. They've got multiple different things that does compromise their immune system, that does put them at a higher risk for complications after they get one of these infections. One of the most important things, just as Jackie had said, is vaccination. We have a flu vaccination. I can't support getting vaccinated enough. All of the staff, we make sure that we have our residents vaccinated every year. I'm one of the few, well, I don't know if it's few, but I'm one of those people who has a genuine flu shot allergy. So I depend on the people around me to get vaccinated to keep me protected. I have asthma and a couple of other issues myself. So on a personal note, vaccination helps many different types of people, not just the individual getting the vaccine, but family members who can't get it, family members who are immunocompromised and may have complications related to getting the infection. So one of the most important things is making sure that you get that vaccine. And I support the COVID vaccine when it does come out. I think that this is going to be a game changer for us, and I'm really looking forward to it.
And let me just piggyback a little bit into one of the things you said, which I think is very important for people to know, which is comorbidity. Mm-hmm. Can you speak more about that in terms of what that means, and how does that work in people, and how does that affect or kind of compromise people who have immune compromised situations? How does that play into all of that?
Sure. So comorbidities are coexisting diseases within one person. So you may have an individual with hypertension, with diabetes, with COPD. So these are chronic conditions that exist at the same time. And when you stack all of these conditions on top of each other, you really create the perfect storm for some serious complications if that individual gets sick. And that's with the flu, with COVID, with various different types of illnesses. It's very important to protect these types of people because they have these different coexisting conditions that all work against them, that all interfere with their immune system functioning.
Wow. So,
Yeah.
So, Steph, I'm just thinking right now as you speak, and so what preparations do you think families should begin to make now? Now, Thanksgiving is approaching, family gatherings is on its way, everybody's confused.
I have anxiety as soon as you say that.
So, what do you think we should be doing right now? What do you think, what will be your best advice to people in terms of the holidays, given the uptick in COVID, and now in the flu season, and then we don't really have a vaccine for COVID yet, and even the flu season that we have vaccine for, people still don't really want to take it, and we try to encourage people to take those vaccines because it protects people, it saves lives. Yeah. What is your advice? What do you advise us to do?
So I'm thinking about this from two different perspectives. I'm thinking about it from the perspective of a healthcare provider and a health and family services commissioner. And one of the most important things that we can do, which we're doing right now, is educating the public, is providing them with information and people who are knowledgeable in the field and can talk about these things. The more education we give people, the better they're able to follow the most recent guidelines and keep themselves protected. It gives them more tools to be able to keep themselves and their loved ones protected. The other perspective that I can speak from is that of the family members of people who I have in my care center, for example. Since COVID happened, there's been a lot of frustration because visitation was banned. People aren't able to see their loved ones face to face. It's very, very important that people continue to adhere to the mask mandate, to self-monitor for symptoms, to stay home if they're not feeling well. especially people who are in the workforce and going to work and could expose others. Being upfront and honest, if you've had someone that you live with or someone that you've come in contact with that has potentially exposed you, making sure that you communicate with your employer, communicate with the people around you, and understand that it's COVID is very, very serious, but it's also something that we can manage if we are careful, if we protect ourselves, if we isolate and quarantine, depending on what the situation calls for, if we're honest and upfront. So I would implore families, community members, communicate with us, communicate with your employers, stay home if you're not feeling well, monitor for symptoms. It's interesting, Jackie was talking about, we were talking about the incubation periods and some of the symptoms of COVID and the flu. And there's quite a bit of overlap, but there's also a lot of overlap with other seasonal illnesses, strep throat, and all of these other things that we get sick with in the fall. So it's very, very important. The general person is not going to know, oh, this is strep and not COVID. So if you have symptoms, stay home, contact your healthcare provider and get evaluated. And don't be afraid to communicate with people and say, hey, I'm not feeling well. It's okay. We want you to say that because we want you to be well. We want your family and your friends to be well. And we want to protect the people around us.
And speaking of symptoms and the need to stay at home during this time, if you get sick, can you, in terms of specific symptoms of flu, COVID, and possibly all these fall-related illness that we have, so we don't get confused about, oh, I have this now, it must be this, or it must be that, it must be this. Oh, I'm having this and I don't have that right now. Oh, I'm getting into this, I'm having this problem. Can you help us dissect the differences in terms of the symptoms of one, and what do we watch out for in terms of the specific symptoms that are related to specific infection? If it's something you can do, that would be great.
I wouldn't be able to. Jackie can speak to this too, because many.
The question is for both of you. Jackie, please chime in as much as you can.
There's no way to be able to say something so specific because all of these different fall illnesses, a lot of them have a lot of the same symptoms: sore throat, fatigue, headache, runny nose, cough, fever. There's so many different illnesses that cause a lot of these same symptoms. So that's why my general advice to people is, if you're feeling any of these things,
any of these symptoms you're seeing,
stay home and call your doctor and say, you know what, I'm not feeling well. This is when this started. And your doctor is likely to ask you some questions. And one of those questions is probably, have you been exposed to anyone with COVID? Have you traveled? Some of those types of things. But your healthcare provider will help you kind of rule out some things and possibly come in and get you tested for certain others to rule them out in a more diagnostic fashion. But it would be impossible to be able to dissect and pull apart different symptoms for different illnesses. And Jackie, you can certainly chime in here, but that's a tough one.
Yep, I absolutely agree, Stephanie. There are some things where, CDC and WHO has put out some information on when you might see, you will likely have a fever if you have flu, but it's very rare if you have a cold, but it is common when you have COVID-19, but you would never get it if you were just experiencing allergies. So it's more of probabilities as opposed to definitive, you have this, so it is this. I think Lyme disease and the erythema migrans rash, or that bullseye rash, is about as close as we can get. Is if you have this, you have Lyme disease, but the rest of it is a little bit of everything. And that only happens 60 to 40 to 70% of the time, depending on people. So it's very difficult. So it's really important for them to, I completely agree, Stephanie's sentiment. They must. This is the most important time to develop a relationship with a primary care provider. This will do wonders for other public health issues as well as we move from the pandemic phase to the aftermath to other public health problems, chronic conditions that might get impacted by, of course, the pandemic, and people may be afraid to go to their doctor or not going to their doctor or what have you. This is a really good time to establish a primary care provider so that you can call them when you have symptoms of anything so that they can give you their clinical, medical, professional opinion and evaluate you based on all of the mitigating factors and not just one or two symptoms that you may have, but taking a look at the whole picture and all of your potential exposures and that picture for you. So I couldn't agree more.
Yeah.
Wow, thank you guys for sharing these thoughts on these very important issues that we're going through right now. There is this common rumor news out there that I think is very, very erroneous, that I want you guys to kind of dispel those rumors, those errors in understanding what it is. And that's to do with masks, the use of masks. There have been this problem of, oh, the mask doesn't work. I know we can't emphasize this much more than this, but can you speak to the specific reasons for the use or for the encouragement to use masks? Either of you can start.
So I work in the nursing home right now, as I've mentioned, and we're required, all of the staff are required to wear a mask, and we have to ask the residents they have the right to refuse. That mask really, when worn correctly, and Jackie can speak to this also, when worn correctly, that mask reduces the chances of transmission of COVID and some other things too. And that means wearing it tightly enough around your face, covering your nose and your mouth. I've seen people with it slip down, but making sure you wear it properly.
Let me get a mask and maybe let me see if I'm wearing it correctly. Maybe that will help.
You better be. You work for Garnet. You better be.
Listen, anything can happen. So this is how I wear my mask.
Good. So from what I can see, it fits good around the bridge of your nose. It fits flush against the sides of your face, and you have it covering the underside of your chin. So that looks like your mask is worn properly.
Okay, thank you. So I'm following the guidelines correctly.
You're following the guidelines. Yes. And especially working in a healthcare facility, we make sure that we change out our mask every shift. More often, if we're breathing a lot and it's getting moist, we make sure that we clean it. But cloth masks are an effective barrier as well. So I know some people say, well, this isn't, it's not really a mask. It is. It provides that protection. It keeps you from transmitting the virus to other people. And it does offer some protection if someone is speaking to you. It creates a barrier. There are other methods that you can utilize as well, and Jackie can speak to this too. But if you're unable to tolerate a mask for medical reasons, there are face shields. There are different protective measures that you can put in place that are not a mask, but the mask is the number one go-to that we recommend. We really don't go anywhere without it. My kids don't go anywhere without it. It's the cell phone and the mask. Just
so it's not just for adults, even kids should wear a mask, right?
Kids can. And I know with younger children, sometimes it's challenging, but what I have found, so I have nieces and nephews and they're a little bit younger. And what you do is you work with the child. So you build up a tolerance. At first it's this foreign thing that's on their face and they'll protest, but a little bit each day, incorporate them into the process, help them maybe choose one that they like. If they like, I don't know, Frozen or whatever cartoon character. So involve them in the process, that get them engaged. They can choose the ones that they like and then build up a tolerance to it. And very much, and model that behavior as well. So as a parent or someone with small children, when you go out, always make sure that you wear your mask, you show your child that you're wearing it, that you're protecting yourself and others. It's very important. But that's my recommendation with younger children, is to build up that mask tolerance, because it is a foreign thing. And I don't know if you have small children, but children are very inclined to touch their faces. Yep. And this also provides a deterrent. So they're less likely to be putting their fingers in their mouth if they've got a mask over it, which, helps minimize transmission as well.
Well, thank you so much, Stephanie. Jackie, you have anything to say on that?
I think Stephanie covered it. It looks like Dr. Morgan joined us as well. He seemed to have raised his hand. Maybe he has something to say.
Oh, Dr. Morgan? Oh, yeah. Yes, I've been waiting to bring him in. Let me bring him in. He's the infectious disease doctor that we have among us. Hi, Dr. Morgan. Your mic is muted.
See, yes, and start video as well.
Oh, good, good, good.
Okay.
I just told everybody that you are at work, that you might join us at some point in time. So, hello everyone. This is Dr. Morgan, Michael Morgan. He's our infectious disease doctor in the house. So, doctor, can you tell us more about yourself, where you've worked, what you do, what is your own area of specialty?
Okay, so I'm Michael Morgan. I'm currently working here, as you know, at Garnet Health. I do infectious disease between Catskill and Orange Regional, but I work as a hospitalist 7 on 7 on here at Catskill. I worked at Harlem Hospital before, did my fellowship between Harlem and Columbia University in infectious disease. Most of my training was actually at Harlem Hospital. I did 2 years preliminary surgery, 3 years medicine, and then another 2 years of infectious disease. So,
wow, you're a busy guy.
I try to keep myself busy.
This is good. So,
yes.
doctor, we've been talking all evening about the infections we have right now, the flu season with COVID, with the vaccine that is being processed right now. And then Jackie is the director of epidemiology in Orange County. And Stephanie is a commissioner. Stephanie, somebody has to do something to my brain with your name.
It's a long title. It's okay. And it's the end of the day.
So she's the commissioner for health and family services in Sullivan counties. They've spoken well about some of the things I would like you to put your stamp on them as an infectious disease doctor, because you are the guy we've been waiting to hear from for the past 30 minutes. So,
well, I've actually chimed in and I've been listening, and I don't think there's much that I could add to what has already been said. So when
everybody wants to hear from the doctor.
Well, I mean, this is pretty much a team effort, but just to confirm what was being said earlier, the mask, if it's worn properly, it does prevent the transmission of whether it's COVID or flu. And I'll just use the flu season as an example. Normally, when someone has a flu, we normally wear a mask when we're going in their room and we put them on isolation. Mm-hmm. So that is just an indication that we have something similar. It's spread similar to the flu, more virulent, like COVID. So it's only proper that we would wear a mask, and wearing it properly can prevent and is preventing the spread of COVID, as you know, because for many of those areas that we're not seeing much COVID, when they were outside without the mask, then you tend to see a mushroom cloud form with COVID, and it's now taken over the entire country. So you wore your mask, you had your mask on properly, but I want to show you something. Okay. So after you have your mask on, what we normally do is pinch the nose a bit, because this normally has a rim and it makes it seated properly here to minimize any open area that you might have. So it's not just putting the mask on that you have, but once you put it on, it's also pinching this nose area to make sure that it's seated properly. But everything else is correct. Okay. In terms of how you're wearing the mask.
Okay. Wow. So tell us about, thank you so much, Dr. Morgan, for that. Now we're hearing that there are 2 vaccines in the works for COVID, and people are afraid of taking the flu shots. Now, vaccine is going to come out eventually for COVID. What would be your advice for us? What would you advise us to do for the general public?
So, I know there are the anti-vaxxers out there. We know from history that vaccine have prevented a lot of illnesses and deaths over time. Polio is one of those things that we've cured, and we're seeing in areas where that have not been, the polio vaccine have not been administered, in certain countries where we're seeing a rise. We're seeing the measles. We had an outbreak just last year for people who didn't want to take the measles vaccine. So vaccines are there for a reason. I think one of the important thing is making sure that people are confident and I listened to Dr. Fauci and them, and they're perfectly right. If people are not comfortable with taking vaccine to begin with, and now you have a vaccine that's politicized where people think it's rushed through or people think it's not vetted properly, then you will have an issue in terms of getting people confident in taking these vaccines. But definitely once I'm able to see the research, because yes, I hear what Pfizer said, I heard what Moderna said, but I actually want to see the numbers, how many people were treated. I want to see how many people you had to treat with the vaccine to see how many people were actually it was effective with. So say, for example, if you treat 100 people with the vaccine and it's only one person that benefited from it, then, I need something more than that. So these are numbers that scientists, medical professionals will be looking at before they can say a vaccine, it's ready to be, implemented and passed out in society, because nobody wants a vaccine that, so many people are going to be taking, but only a few people are really going to benefit. There's some benefit, but we want to make sure that the numbers needed to treat are, really, minimized before you can have some effectiveness. So say, for example, the epidemiologists can even speak to this better than I can, with the fact that when you're doing vaccines and you're doing medication, you think about how many numbers will be harmed by the medication versus how many are treated. And this is how you kind of weigh whether or not if it's effective and if it's a medication that you can actually put on the market.
Wow.
I don't know if I answered your question or if I just went around in circles just now.
Yes, you went around in circles, which is actually very good for us to kind of see how you kind of compare what is going on right now to measles, to polio, and to all of that, because that tells us that we have a history of infectious disease going around, and we have a history of how we treat them with time. And that kind of validates the fact that whatever we're doing right now is the right thing to do, and is the proper way to approach them, making sure that we have enough data to support the use and to kind of build people's trust in the vaccine. Because now there are so many misinformation out there. And so if you don't really put the right information out there for people to hear from healthcare professionals like you, public health specialists like Jackie, and then the commissioner in the county who has worked in several of these departments in the county, to put out the right information out there, somehow we may be part of this misinformation, which we don't want to do. And we are almost at the end of the session, but I want us, each of you, Dr. Morgan, Stephanie Brown, and Jackie Lola. Unfortunately, we don't have the audio for Dr. View. And by the way, I was just trying to private message Dr. View right now. As a sequel to this session, we might be having a session with him, just him alone, to talk about stress management and COVID, stress management and the flu season. It's going to be a sequel to this, maybe in about a month or in about 2 months from now. I will work with him to see what works for him, and then we can plan something. And then please, viewers, listeners, keep our eyes out there to hear, for the next session after this. And on a final note, what message do you have for people regarding boosting our immunity during this season, Dr. Morgan? How do we boost our immunity during this season?
So it's a little tricky in some ways, because there are multiple ways. Proper diet, it's very important. I think we have lost, and we've seen where people are trending back to the old way of preparing their meals. We have a lot more people who are health conscious in terms of getting proper protein. They're getting enough vegetables in their diet and getting rid of some of the red meat. We see a conscious effort by society now in becoming a bit more active. We see so many gyms popping up. Unfortunately, with COVID, many of them are closing, but people have come up with very creative ways of also bringing the gym inside your house. So like my son and I, we do our bicycle riding. You know,
In the
now,
house.
well, not in the house, on the outside. But,
Oh, okay.
you know, but some people have the cycle, some people have a spin cycle. So they'll log on to Poltron, or many of these other gyms are now doing Zoom classes.
Yeah.
We have sleep. A lot of people like us in the healthcare professional, we take sleep for granted, but you do need proper rest to make sure that you can overcome some of the illnesses or the disease that you might be exposed to. So your health, your diet, you know, your sleeping and well-being, and most fundamentally, we don't have the mental health person here, but that's a key factor in keeping ourselves healthy and boosting our immune system and your regular vitamins.
Yep. And that is why, just to add to what you just said, that is why it's important for me to have another session with Dr. View with regards to mental health and what we should be doing during this season as a sequel to this session. And Jackie, you are a public health professional and epidemiologist. What message do you have for us? Your concluding message for us.
In terms of mental health?
In terms of this season of flu, COVID, or in the influenza season, what message do you have for us in general?
Just in general for flu, I think, you know, I kind of reiterated the need for flu vaccination, the need to wash your hands and stay home when you're sick, and of course, wear your mask wherever you go. But I don't know, I think I couldn't hear anything that Dr. Morgan had said. So was there anything else you wanted me to address from a public health perspective?
Yeah, I'm actually asking questions specifically about your final advice to us from your own experience and work experience, your work as a public health official.
Yeah, so those are the big ones. Those are the really big ones. Please get vaccinated for flu. Please wash your hands. Please don't gather with other people while you're sick. Please stay home while you're sick. Continue to wear that mask, and you know, limit your interactions with people this holiday season. It will do wonders for not only COVID, but definitely for flu transmission as well.
Oh, thank you so much, Jackie, for that. So, Steph, our dear commissioner who oversees several departments, a busy lady, can you tell us what would be your advice for the community in this regard?
So I agreed with Dr. Morgan and all of his advice regarding making sure that you're eating healthy, that you're taking vitamins, that you're resting. My advice with exercise, I did some of the things that he had mentioned. I actually built my own little home gym in the basement, and I don't eat meat or dairy, so there's that. But taking an opportunity to get exercise wherever you can. If you've got stairs in your house, you know, if you're one of those people who has to work from home, take those opportunities, look around you and see where you can do some different things to stay active in ways that you wouldn't typically think about staying active. Always increase your fruits and vegetables. Those are the foods that are going to give you those protective vitamins and minerals that are going to boost your immune system. My advice is also to be gentle with yourself, and those around you, because we're going through a very stressful time. There's a lot of fear. People are worried about a vaccination. They're worried about getting sick. They're worried about their loved ones getting sick and dying from this very serious infection. So I think it's really important to mention that you need to be gentle with yourself and be gentle with others, and understand that this is difficult and that people are having a hard time, and that's okay. You can take a moment. It's okay. Be patient with your healthcare providers. Don't feel stigmatized or don't get sucked into that feeling like there's a stigma attached if you're not feeling well. Lots of people are getting sick, and it's okay. So communicate with your healthcare providers. Just as Jackie said, make sure you wear your mask, practice good hand hygiene. Your local public health department is a wonderful resource. So if you have questions or concerns, always feel free to reach out to them. They've got a wonderful, whether it's our surrounding counties or Sullivan County, there is a tremendous workforce full of competent, knowledgeable individuals who are just waiting for you to call and say, hey, I've got this question, because they want to help you and give you the information. So that would be my final thoughts.
Can I add one thing?
Yes, Doc.
So I know they've been emphasizing this tremendously in the media, and it's very, very important. We love to see our families because we work so hard, and the Thanksgiving, the Christmas, and all of that is the only time we tend to have that large family gathering. Think about it, because there are times when my family members might not be doing the same thing that I'm doing. If I have a family member that's all over the place and traveling here and traveling there, or partying here and partying there, who shows up at my house during Thanksgiving, that person is going to put my son and, you know, my mom, whomever might stop by, at risk. So while we love our family, we might need to spend that holiday with just the immediate family, because don't think everyone in your family is doing the same thing that you're doing. You would love to think so, but we do have a few people in our families who will not follow the guidelines as well, and might put you and your family at risk.
Wow. Thank you so much.
So loving them really has a different definition this holiday season.
Absolutely, absolutely. Yeah. And Dr. View is very much on the panel, but he just can't speak to us because his microphone is not properly working, has a final note, and he wants me to read that final note to everyone. He said, also mention that meditation exercises to help alleviate stress. Uncontrolled stress can weaken immune system. Self-meditation can help build and boost the immune system. From Dr. View, our Director of Behavioral Health Services for Garnet Health. Wow. Thank you so much, everyone. Jackie, thank you so much. Dr. Morgan, for stepping out of your work to speak with us and to be with us this afternoon, this evening. Thank you so much. I appreciate all of that. And Stephanie Brown, you and I need to talk more. Jackie, I know very well. We've been talking for the past 2-3 years, but you and I really need to sit down and talk and plan something for the county, for Sullivan County. And thank you for the work you do. Thank you, Dr. Morgan. Thank you, Jackie, for the work you guys do. Dr. View, unfortunately, we couldn't hear you, but we know you are with us. And I had read your final notes to everyone. And he's waving at me. I can only see his picture, but I can't hear his voice, unfortunately. So like I said before, I'm going to work with Dr. View to organize a session with him to talk about the mental health, the behavioral health services related issues which we watch out for and how we need to take care of ourselves during this season of flu, COVID, and the influenza, to find a way to help build ourselves up and protect ourselves so that we don't max out our expenses on healthcare when we can easily do something very easy to take care of ourselves, and then we don't want to over-labor the healthcare system as well. Thank you, everyone, and all our viewers, all our listeners, wherever you are on this Zoom link or on YouTube Live. Please, if you have a question for us, for any of the doctors, reach out to me and I will get your information, your questions to the right person when that time comes. So enjoy your evenings, have fun, get some rest. Dear panelists, do what you're telling us to do. Rest yourselves, you need rest. And looking forward to working with you in the future. Once again, thank you, Juan, and thank you all, and have a good night.
Thank you.
Thank you for having us. Thank you, everyone.